Hello, everyone. My name is Kristen Vargas. I am one of the benefits analysts that is assisting with the San Bernardino County Retiree Open Enrollment. I will be doing the presentation today. We also have Diana Ruiz, who is the analyst that oversees the Retiree Open Enrollment. She couldn't be here with us today, but I did want to introduce her. So if you have any questions during the presentation, you're welcome to enter it into the chat. We do have Blue Shield here today, Kaiser, Delta, and Voya to be able to present their slides. I will go over the San Bernardino County slides, and then we will go ahead and have them present their portions. So for us today, we have the San Bernardino County Retiree Open Enrollment, and the Open Enrollment will run from November 1st to November 30th. For the 2020 Retiree Guide, those have not been sent out yet. They will be available online November 1st on our Retiree website. The guide is kind of more of a outside theme. You'll see when you receive your guide in the mail, if you request to get it via mail, you'll see it kind of has like a lake on it, a boat. So that is our guide that you'll be using to keep as a reference throughout the year. It contains information on the county benefits for retirees, such as important dates and deadlines, plan premiums, plan benefits summary, enrollment forms, and contact information. And we also have the guide available on the presentation. You can view the guide at our SB County Benefits Retiree Benefits webpage. What's new for 2020? This year we would like to continue our Going Green, basically our Go Paperless initiative. We would like our retirees to contact us if they would like their guide sent via mail as a hard copy. Other than that, the retiree guide will be available online on November 1st. And if you would like to receive electronic copies of anything, you can contact us at our ebsd@hr.sbcounty.gov email or by phone through 909-387-5787. You can let us know if you would like your retiree open enrollment information sent to you electronically or by paper. For this open enrollment, again, those dates are running from November 1st to November 30th. Changes made during open enrollment will be effective January 1st, 2020. And during this open enrollment, you can enroll in a plan, change plans, cancel coverage, or add and drop dependents. Important dates and deadlines for this open enrollment are, again, that open enrollment period is running from November 1st to the 30th. On November 11th and November 28th to the 29th, we just want to make everyone aware that our office will be closed in observance of the holidays, that being Veterans Day and then the Thanksgiving holiday. On November 30th, all enrollment or change forms, even cancellation forms, are due to us by 5 p.m. And then come December 6th, it will be the last day to submit proof of dependency and or dependent disability forms. And on January 1st, 2020, that is the effective date for new premium rates and benefits. New premiums will be taken from your December 2019's benefit payment. So just remember, if you are making any changes, that the payments will be taken out on your December 2019 payments, and those will be effective as of January 1st, 2020. So for your premium rates, we have new rates that are effective January 1st, 2020. Our new rates are posted on our website under premium rates. You'll be able to see what the new rates are that we offer for both Kaiser and Blue Shield. Most common rates are listed on pages 10 and 11 of the 2020 Benefits Guide, which again will be available to you as of November 1st. And if your specific rate is not listed, or if you are not sure what your rate will be, contact EBSD at ebsd@hr.sbcounty.gov, or you can contact one of our two phones. We have a regular office phone number and a toll-free number. And remember that your premiums are paid on a monthly basis, and your premium will be the same each month. Okay? So what is new for this 2020 plan year? We have new lower premium cost non-Medicare plan options that are available to you. we are excited to introduce the 2 new medical plan options that are being offered alongside our existing plans. So we will have our existing plans along with these 2 new plans. One is the Blue Shield HMO Trio plan. It offers a lower monthly premium, has a 9.5% savings from the current low plan, provides a narrow network, there is no calendar year max, and your out-of-pocket maximum is $3,000 per member and $9,000 per family with a 0 calendar year deductible. For Kaiser, we have the Kaiser HMO High Deductible Health Plan. You'll notice that will also be seen as a Kaiser HMO HDHP plan. This one also provides lower monthly premiums, has a 24.9% savings from the current low plan, is a health savings account qualifying plan. The out-of-pocket max is $4,000 per member and $8,000 per family. And your calendar year deductible is $1,500 per member and $3,000 per family. For the benefit options, the county offers retirees and eligible dependents their choice of different medical plans and different dental plans. In our medical plans, we are providing the Blue Shield HMO or PPO/Medicare or non-Medicare. For Kaiser, we have Kaiser HMO/Medicare or non-Medicare. And then your enrollment eligibility may be affected dependent on your residential zip code. So just keep in mind whatever your zip code is, it can affect the type of plans that you are eligible for. For dental plans, we have Delta Care USA DHMO and Delta D PPO, and a high and a low option. For our out-of-state options, we have a medical Blue Shield PPO coverage is available nationwide. And for Kaiser, coverage is available in Washington, Oregon, and Colorado in limited zip codes. So if you are unsure, please contact EBSD and we'll be happy to discuss further with you what would be eligible for out-of-state options for either Blue Shield or Kaiser. For Delta, D PPO coverage is nationwide, and Delta Care USA DHMO provides benefits in 14 states. Those 14 states are Arkansas, Arizona, California, Florida, Georgia, Idaho, Michigan, Missouri, Montana, Nevada, Oklahoma, Oregon, Texas, and Washington. Some things to take into consideration for open enrollment, such as who will provide your care, your choice of provider networks, physician choices, and where will you receive your care, hospitals and urgent care facilities, what services are covered, preventative care, prescription drug coverage, and other things. How much will you pay for your services you need through coinsurance, co-pays, and deductibles? In county group retiree plan versus individual plan, there are limitations and exclusions. And the county group retiree plan versus COBRA. The difference are the premiums, the co-pays, the deductibles, and the Medicare eligibility. If you would like to enroll in a plan, change your plan, add or remove dependents from your plan, or cancel, these are how you would do so. So if you are going to enroll in a plan, change a plan, or add or remove dependents from your plan, you will need to complete the county's enrollment/change forms. And you would also, if you are in a Medicare plan, you would need to complete a Medicare enrollment form if enrolling in a Medicare plan, and a separate form is needed for each enrollee. Now, if you're going to cancel your coverage, you would need to complete the county's disenrollment form, complete a Medicare disenrollment form if canceling a Medicare plan, and a separate form is required for each member. A member who terminates coverage during open enrollment is not eligible for COBRA, as this is not considered a COBRA qualifying event. So please keep that in mind for any of those that are looking for COBRA to enroll into COBRA. This would not make you eligible if you were canceling your coverage. Proof of dependency is required for those that are going to be newly enrolled dependents. So if you are a newly enrolled dependent, a marriage certificate is required for a spouse, a birth certificate or a court document is required for a child, and you will need a state registration of domestic partnership form for those that are in a domestic partnership. Children that are 26 and older who are incapable of self-support due to the disability are required to submit a disabled dependent certification form, which is required from your physician and must be submitted annually for non-permanently disabled dependents. Please keep in mind, if you are a permanently disabled dependent, or if you have a permanently disabled dependent, you will not need to submit this form every single year. One form will suffice. To discuss our HMO plans, we have the Blue Shield Signature HMO and the Delta Care USA DHMO plan. So for those that are looking to enroll in those plans, please keep in mind that you must select a primary care provider and a medical group. You'll be able to do so on your forms that you fill out for enrolling in the retiree benefits. You will have to select that primary care provider. If you do not select a provider will be automatically assigned by the carrier based on your home address. You are able to change your provider by calling the carrier's customer service number. So if you do not select a provider, they will provide one for you. And if you would like to change that provider, you would just need to contact them directly. Okay? For mid-year changes, outside of open enrollment, you may enroll in a plan, change your plan, or add dependents to your plan if you experience a mid-year qualifying event. Examples of qualifying events include loss or gain of Medicare eligibility, loss of group coverage, an exhaustion of COBRA benefits, loss or gain of dependents, and if you move out of the service area. Mid-year change requests must be received by our Employee Benefits and Services Division within 60 days of the qualifying event date, and it must meet the guidelines of the county's contracts and agreements. You can refer to page 17 to 19 in the guide for a complete list of qualifying events and required documentation. COBRA and CalCOBRA. So current COBRA or CalCOBRA participants can enroll in the retiree plan during open enrollment, enroll once your COBRA or CalCOBRA exhausts, which is after 18 to 36 months respectively, and enroll once you become Medicare eligible. Please note that if your COBRA coverage is terminated for non-payment or you voluntarily drop coverage, you will not be eligible to enroll in a retiree plan until open enrollment. And then also note that for dental or vision, no CalCOBRA is offered. And to enroll in CalCOBRA, submit an application to the health insurance provider directly. Do not submit your forms to EBSD, as we do not assist with CalCOBRA. For your Retirement Medical Trust Fund, also known as your RMT, you will need to update your recurring individual premium reimbursement request form for premium or plan changes. This form is located on the back of your retiree guide. You will be able to access this form as well on our website. You can provide proof of your insurance coverage with the new premium amount, and you would need to submit the completed form to TASC, also known as Total Administrative Services Corporation. Access your RMT online through www.voya.com. Retiree Wellness. The county's Retiree Wellness program offers the Steps to Success online fitness portal. We also offer discounted health club and gym memberships and access to wellness tools through your retiree medical plan providers. We have health club discounts. There is a reduced club membership at 24-hour fitness with no initiation fee. Existing members may have monthly dues reduced to the county's discounted rate. Eligible dependents may be added at a reduced rate. And for more information in regards to our health club discounts, please see page 77 of the retiree guide for more information. All open enrollment forms and documentations can be found on the back of the guide when it is received via mail, but it can also be located on our website come November 1st. Enrollment and change forms and dependent documentation must be submitted to Employee Benefits and Services Division at 157 West 5th Street, first floor, San Bernardino, California, 92415. If you need any further assistance, please contact our EBSD team at 909-387-5787 or if you prefer to use a toll-free number, you can call us at 888-743-1474. We are here to help, and we want all of our retirees to know that they should not hesitate to contact us via email, by phone, or just come to our office, and we'd be happy to make an appointment with you to go over your retiree benefits. So if you have any further questions, please go ahead and put them in the chat on our webinar, or contact us again via email or by phone. Thank you so much. I'm going to go ahead and give it over to our Blue Shield presenter, Mary Hazel.
All right. Hi, everybody, and welcome to the 2020 retiree presentation. Blue Shield is excited to be here again, and we're going to just go through today a little bit about Blue Shield, the plans that you have, what might be new, and if you do have any questions, go ahead and type those into the chat feature, and somebody will monitor the questions, and we'll get back to you as we go along. So just talking a little bit about Blue Shield, we have our high performance networks. We've got a number of technology tools to assist you, our core programs to improve and maintain your health, and our high value products, services, and networks. There's some big differences between the plans, and you need to think of a couple of questions about which one might be right for you. So the Blue Shield plans for retirees this year, we continue to offer the Shield Signature plans for non-Medicare members. There's the Shield Signature High and Low, and there are no changes to these plans in terms of the benefits. We continue to offer the Medicare integrated plans, so the GMA PD High and Low, the 65 plus plans for Medicare eligible individuals, as well as the Medicare prescription drug plan that we pair with the PPO plan for over 65 retirees. And then we also offer an under 65 retiree PPO plan. What's new this year is the Trio HMO plan for non-Medicare members. All the other plans have no changes, and we'll go through and talk about the Trio plan as we go along. The Trio HMO plan is a single level HMO plan. So today with your Shield Signature plan, you have the level 1 and level 2, with the level 1 being your HMO medical group and the level 2 where you can opt out for an office visit. So the Trio HMO only has the HMO level available to you. That's the first difference. There is no annual deductible. The calendar year copayment maximum is $3,000 per individual up to $9,000 per family. So if there's 2 of you, it would be $6,000. The office visit is $50 a visit. For inpatient hospital stays, and this is a big difference between the Shield Signature and this plan, there's a $1,000 admission fee. So it doesn't matter if you're inpatient for 1 day or 30 days, you pay that same $1,000. For an outpatient surgery, if you have your knee surgery or gallbladder or something like that, it's $750 per surgery. Ambulance services are $250 per ambulance emergency transport. Emergency room is $250 for an emergency room visit. And then diagnostic, lab, and x-ray, there is no charge. Retail drug co-payments are $10 for Tier 1 drugs, which are most of your generics, $30 for Tier 2 drugs, and those are some generics and Blue Shield's brand formulary, $50 for the Tier 3, which is a non-formulary, and then $50 for specialty medications, which are the Tier 4 medications. So what makes the Trio plan different? Trio is Blue Shield's fastest growing HMO, keeping members highly satisfied with convenient access to care among known local providers. The Trio network is a subset of Blue Shield's traditional HMO network, and we do have a link to those providers on our microsite for the county. In your local area, Beaver Medical Group is one of the TRIO providers. St. Joseph's Medical Group in Orange County is a TRIO provider. Prime Care Medical Group in the Inland Empire is one of the local TRIO medical groups. The TRIO also offers HEAL Doctor on Demand services via phone, web, mobile, or in person, and your first visit is no charge. They also, if you have a visit with a HEAL provider, there's no copay for RX delivery, and there's no copay for our teledoc providers. You choose your own doctors, specialists, and pharmacies within that TRIO network, which again is a little bit narrower network. You have access to teledoc doctors. Teledoc is like urgent care, only over the phone. And you have end-to-end service with our Shield Concierge customer service. We also engage in digitally enabled wellness programs, and you have access to urgent and emergency care coverage throughout the United States and around the world. So what is HEAL that we just talked about that's available with the TRIO? And just as an aside, HEAL is also available to members in the PPO plan. So suppose you're at a conference or you're on vacation and you have a bad sore throat and you want to see a doctor. Through the HEAL network of physicians, house calls, hotel calls, a doctor when and where you need one for urgent, primary, and preventive care is available. Your first visit with TRIO is at zero copay, and your subsequent visits are at your office visit copay. You book a doctor on demand. The requested time is at least 90 minutes ahead of when you would like to see them, but it can be further ahead of time. And it's more convenient than a visit to the emergency room or even the urgent care. And it's available from 8 a.m. to 8 p.m., 365 days a year. LifeSpring is another benefit of the TRIO program. So this is only available to TRIO members. It's free meal delivery for members who may be undergoing some sort of serious illness. It's intended to provide those TRIO members with convenient and nutritious meals while they're recovering. So maybe you've had a cancer surgery or a hip replacement surgery. You're at home. You don't have a lot of at-home support. Through LifeSpring, they will deliver. It's kind of like a HelloFresh or Blue Apron prepared meal. They're geared towards people with special dietary requirements, and they are available statewide. Your care manager would determine your eligibility and work with you on a meal service delivery frequency. Okay. Also available to the TRIO members is Call the Car, which is non-emergency transportation for TRIO members. And if you'll all give me just one quick second, I've been told that my screen looks small to you, so let me see if I can make this a little bigger and easier to read. Aha, there we go. I hope that's a little better. So Call the Car, non-emergency transportation for TRIO members. It's for eligible TRIO members. Maybe they're undergoing a recovery from a serious illness. Maybe they need help in transportation to their, like a chemotherapy appointment. Again, they, maybe they don't have a lot of in-home support, so this would help them get to and from those appointments. And you'd work directly with your case manager to set up those services. So TRIO HMO or Shield Signature, how do I decide which one is right for me? The Shield Signature plan has a broader HMO network and offers more choices of doctors. The Shield Signature might be right for you if you want to choose your own doctor with the level 1 benefit and self-refer to those level 2 physicians. Shield Signature offers teledoc, a digitally enabled wellness program, and covered urgent and emergency care while traveling. The Trio HMO might be a good choice if you find your provider within our select integrated provider network, and those doctors provide you with a more coordinated care. It also offers teledoc for all of our members at a zero copay, a digitally enabled wellness program, a covered urgent and emergent care while traveling, and the Heal at Home doctor with the first visit at zero. Trio HMO, I'm going to go back to 100% here. Trio HMO or Shield Signature Low options, we're going to show those side by side. So neither plan has an annual deductible. The calendar year copayment maximum is $3,000 per individual. And for the Shield Signature, it's also $3,000 per individual. The copayment maximum, calendar year copayment maximum, that's like a bucket of money. And every time you make a copayment, whether it's your $50 office visit, your $1,000 inpatient hospital, or the Trio, the surgery, the ambulance, even your retail drug copayments, every time you make one of those copayments, it kind of goes in this bucket. And once all of those copayments total $3,000 per individual, you would pay nothing else for the remainder of the calendar year. This is especially helpful as it protects those members with more serious illnesses that may have multiple hospital admissions, so that they don't wind up with a $20,000 bill at the end of the year. The office visits in the Trio plan are $50. In the Shield Signature Low option, the level 1 visit is $50, level 2 is $80. The inpatient hospital admission for the Trio plan is $1,000, and it's also $1,000 on the Shield Signature Low option. Outpatient surgery is $750 for both plans. Ambulance transport in the Trio HMO is $250, but in the Shield Signature option, it's actually $300. In both plans, the emergency services are $250, diagnostic lab and x-ray are $0, and the retail drug copayments are $10 in the Trio, $30 and $50, with $50 also for the specialty medications. And in the Shield Signature Low option, the retail drug payments are $10 for generic, $30 for brand, and $50 for non-formulary medications, with specialty drugs being generally $50, but they could come in if they were a generic drug at a lower cost. So when you compare the Trio plan to the Shield Signature Low option, the benefits are pretty aligned in both plans. What makes them different is the Trio has a narrow network, and each member of your family that's enrolled in your plan needs to find their provider in the Trio HMO network. So how can you get the most out of your healthcare dollars? The Shield has a few programs to help support and manage your health. We have our Shield Support Program, which is nurse support, home visits, self-management tools, and workshops to help members with behavioral health issues, cancer, chronic conditions such as heart failure, diabetes, COPD. We've got a catastrophic injury program, a musculoskeletal condition and pain management program, stroke programs, transplant processes, plus programs that help with discharge from the hospital or ER, opioid use, and high drug cost referrals. So imagine you feel like this. You have a cold, you maybe have the flu, an earache, and you don't want to go to the ER on Friday night. You have a teledoc program that's available to you, and this is an awesome program. It's like urgent care, but it's over the phone. So pretty much anything you would go to an urgent care center for, you can do with teledoc 24 hours a day, 7 days a week. You contact teledoc, and before you ever do this, you'd like to set up a profile. It kind of like when you go to a new doctor and you fill out that new patient form. You can do it online or over the phone. Step 2 is you talk with your doctor. They resolve the issue. There's zero copay for your plans. And If you need a prescription with these plans, the doctor can submit it electronically to the pharmacy of your choice. We also have, for all the retiree plans, our new Wevolution program, which you can find at wevolution.com. We have online and in-person programs for general well-being and disease reversal. These programs are proven and backed by doctors' methods for results, the largest collection of scientifically backed apps, a personal digital health coach for some of the programs, and a new way to achieve your goals. These programs are all digitally based, so what that means is that they're apps. You go into wevolution.com, you take a quick survey, and it'll say, based on your particular needs, maybe you want to learn to reduce stress or sleep better, maybe you want to learn to exercise more or eat better. They'll recommend, let's say, 4 apps for you. You pick one of them, and any of the services on those apps are completely free to you. And you can switch programs anytime by going back into the Wevolution program and taking the quiz, and maybe this time saying, now I'd like to work on stopping smoking. So this is available to you at wevolution.com. And this kind of walks through the steps. You choose your area of focus, pick a digital provider, and you can create new plans as needed. Blue Shield also offers some wellness discount programs for alternative care. So there's 25% discount on chiropractic and acupuncture services through the American Specialty Health Plan Networks, a weight management program through our Wevolution Diabetes Prevention Program. We have fitness and exercise programs we'll talk about in a minute. We have a new gym program as well as our Silver Sneakers fitness program. We have vision discounts above any vision benefit you might have through the county with a discount provider network, discounts on LASIK, and at Envision Laser Eye Centers. Blue Shield is offering a new gym program this year, and it's called Fitness Your Way. The program provides eligible members with access to over 10,000 participating fitness centers nationwide for $25 a month with a one-time enrollment fee of $25. So what's different between this program and some of your traditional programs is for your $25 a month, you can visit any of the gyms on the list. You could go to LA Fitness on Monday, Curves on Tuesday. If you're traveling to another part of the state or the country and you want to go to a Fitness 19 or an Anytime Fitness, you can find all of those gyms. Enrolled members pay Tivity Health directly, and they can visit the multiple locations, and the offer is available to Blue Shield members and covered dependents 18 years and older. And every person, so if you and your spouse want to join the program, you would each pay $25. And this is available to all the retirees under 65 and for the over-retiree members in the PPO plan. The retirees that are over 65 and in the 65 plus plan have access to Silver Sneakers, and we'll touch on that in a minute. So here we go. So it's only available to the 65 plus HMO members. It provides a basic membership to any of the participating fitness centers, including conditioning classes, pools, specially designed classes, social activities and events, and access to exclusive member community at silversneakers.com. So this is available for free to members in that 65 plus plan. We offer a vision and hearing discount program. We touched on the vision program before, but we also offer a hearing aid discount program through Epic Hearing Services. It's 30 to 60% off on major brand hearing aids and related professional services. Also included in your plan is the All Clear ID identity protection, and it's available for all eligible Blue Shield members, so even your dependents. And it offers ID theft monitoring services, credit monitoring services, fraud resolution, and help with identity repair services. And you would access these services by calling this number below or visiting blueshieldca.com.allclearid.com. Registering for blueshieldca.com is easy. If this is your key to all things Blue Shield, if you're a first-time member, you'd want to have your member number handy, and it's just like creating a password for Amazon or anything else. And at the website, you can get access to any of your claims. You can print a copy of your ID card. You can access your formulary for your pharmacy benefits, look up providers. You can even email any questions you might have to member services, and they have a 24 to 48-hour turnaround time. So if you don't feel like talking on the phone, you can go ahead and send them a quick email. And anything you can do on your laptop or desktop, you can do on Blue Shield's mobile app. And what's kind of neat about this is that it also has a smart feature, so it will pick, if you need an urgent care center, it will show you that urgent care center on a map, just like, Bank of America shows you where the nearest ATM is. And it also has a copy of your ID card, so you don't have to worry about, oh my gosh, I'm out and I had an emergency and I don't have my medical ID card with me. You have your phone with you, you can just pull it up right then and there, and there's a copy of that ID card. And then Blue Shield is here to help. Our member services for the Shield Signature, Trio, and PPO plans are 7 a.m. to 7 p.m. Monday through Friday. That number is on your ID card, and it has not changed since last year. The 65 plus HMO plan, it's available 7 a.m. to 8 p.m. 7 days a week from now through February 14th. After February 14th, it's only available until 6 p.m., I believe. And then if you have a question about your Medicare prescription drug plan, it would be the same number.
Thank you, Mary. We appreciate your presentation. We are going to go ahead and go over to Maricela with Kaiser.
Okay. There you go, Maricela. Thanks, everybody. And if you have a question, please feel free to type it in the chat, and we'll address them at the end of the whole presentation. Thank you.
Thank you.
Thank you, everyone. Go ahead and get started. So hello, everyone. My name is Maricela, and today I am going to share with you your medical plan options, some tools and resources that are on kp.org, and some new services available to you when you're traveling. All right. So why choose Kaiser Permanente? So there's several reasons we believe take a look at as to reasons as to choosing the right plan for you. And it's quality care with you at the center, your care your way. So that means checking in to see what better modality works for you, telephone appointments or in-person appointments with your doctor. Care away from home, that's when you're traveling. Care and coverage built around you. Great care, great results. World-class specialty care. Healthy resources, and managing your care anytime, anywhere. Quality care with you at the center. So at Kaiser Permanente, your personal physician is your biggest advocate for your health. So we suggest that selecting a primary care doctor is important. You can go to kp.org/doctors. You can see available doctors by gender, location, language spoken, and more. You can also view photos of the physician, their education, and some of their credentials. Your care, your way. Selecting the modality of care that's important to you. Maybe you like the in-person visits with your doctor. Maybe you want to opt for a telephone appointment or even a video appointment with your physician. And those are all available to you. Remember that the telephone appointments and the video appointments are at no cost to you, so they don't require a copay. But it's your choice to continue to do those in-person appointments. We don't want to discourage you from going in to seeing your doctor. We just want to give you some additional options and make it convenient for you and save a little bit of money there. You can also call the 24-hour advice nurse line. These providers are available to you 24/7 to take your calls and maybe assist you with an over-the-counter medication or maybe making a routine appointment for you the following day. We're always available to help you. Also, emailing your doctor for those non-urgent questions anytime. Emailing your doctor, maybe you have a question on maybe some lab results that and you have some questions on that. You don't always need to make an appointment with your doctor. Go in and pay a copay. You can always email your physician, and they'll return the email response within 2 business days, if not sooner. All right, so let's talk about the target clinics. So the target clinics are available to you in the San Bernardino County, San Diego County, Riverside County, Orange County, and LA County. So these are clinics that are there for your convenience to treat about 85 minor issues. Maybe you need a flu shot, maybe you need an antibiotic. You don't necessarily need to wait in the urgent care or go through the ER department. It's something minor, and going into one of these clinics will take care of it in a timely manner. So these are available to you in your area, wherever there may be a target clinic that we have this contract with. The most recent one that just opened is in Apple Valley. They are working on a target clinic in Palm Desert and also some in Orange County. And for the River San Bernardino County, there is one in Menifee, scheduled to open soon, and Eastvale. So there's several. So you may want to go into kp.org and check it out and see if there's a target clinic near you. All right, when you're traveling, so we want to make it convenient for you when you're traveling so that when you're traveling, you have everything that you need just in case you have an emergency away from home. Want to contact this number here. It's a 24-hour away from home travel line. It's 951-83900. And you want to maybe make some arrangements with them to send you a travel packet so that you have that travel packet with you when you're traveling away from home. In case you do have that emergency, you know what numbers to contact, you know what next steps you need to take. How do I file a claim? What information do I need to bring back with me from that emergency? All that's important. They can also help you make arrangements for travel vaccinations if you're traveling outside of the country. And also, if you take maintenance medications, you want to make sure that you have enough with you when you're traveling, especially if you're going to be traveling for a long period of time. We encourage you to contact them for any additional services you need when you're traveling. All right, so this is something new. This is also an additional service that is available when you're traveling. It's the CVS Minute Clinics. Now, these are available to you only when you're traveling. Remember, if there is a CVS Minute Clinic close to home and you do walk in there, they may ask you to pay full price for that visit. Then you'll have to file a claim form because these CVS Minute Clinics are only when you're traveling away from home. And how does that work? You pay a copay. Go into the CVS Minute Clinic, and you pay your copay. They will honor that. They'll treat you, give you a prescription. The prescription will be honored there by CVS Pharmacy. It will be all set. But know that you're also covered for emergency services, urgent care, or emergency. This is just in addition to what coverage you already have in the services. We just want to make it convenient for those folks maybe traveling to Las Vegas or Arizona, to another state where, I travel there often, I have family there, or I have a child that's in college away outside of California. This is just kind of another resource, another service for an outpatient visit for minor issues. Right? Now we'll have some of these flyers available at some of the meetings that we'll be doing. So who are attending the meetings, I'll have these flyers for you to take home. All right, so care and coverage built around you. So what is integrated care? So Kaiser strives for a simpler, seamless experience in which the health plan and doctors work together for you. What does that mean? That means that both care provider and health plan are all together in one package. Have your Kaiser primary care doctors there, your nurses, your specialists, all your other specialty services that you may need. They're available all under one roof. So we want to make it convenient for you if you go into one of our facilities, see your primary care doctor, you get a lab test, an x-ray, pick up your prescription, without having to leave the building, and it's all done in one visit. So that is what integrated care is. And also medical records are integrated, so wherever you are at one of our facilities, know that those providers have access to your medical records. Specialty care. Specialty care, we want to talk about mental health. And so at Kaiser Permanente provides clinical and support services for a wide range of conditions, including attention deficit disorders, anxiety, stress, depression, substance or disorder abuse. There's lots that is available through mental health, lots of resources to without needing a referral. Just call, make an appointment, and talk to a provider. Cardiac care. So there's board-certified specialists that are there to treat and help you prevent, detect, and treat some illnesses that are related to your heart and blood vessels. We want to make sure that you know that there's the resources there for you if you need them in any of the specialty cares. And some of the other specialties that don't require referrals are optometry and OBGYN. Those are also self-refer. So healthy resources. So lots of healthy resources available to you on kp.org, like Wellness Coaching by Phone, where you talk to a wellness coach, and these Kaiser providers have access to your records that can coach the goal you have in mind. They stay with you until you have reached that goal, and contact them if you're ever needing to talk to someone. And some of those goals may be just, I just want to be more active. I just want to stop smoking. I want to eat healthier. Lots of different resources available to you. There's also healthy lifestyle programs that are online. Those are programs that are videos you can view online. Maybe you want to lose weight or reduce stress or sleep better. Those are also available to you.org. And in addition to this, you have the health classes that you can, there's lots of classes you can choose from. There's support groups. You just have to talk to your physician. He will need to give you a referral, and they will send you over, the health education department will call you over, will call you for an appointment. And some of these classes, some may require a fee, like a copay, and some are at no cost. But your doctor will need to refer you for some of those support groups and health education classes. There's reduced rates for members also on gym membership through Active and Fit Direct. The gym membership is a $25 a month fee for the membership. There's about 9,000 fitness centers to choose from. They have the big gym fitness centers like your LA Fitness and Family Fitness, but they also have some of the smaller fitness centers like maybe YMCA or some of the ones that have some classes. And you're welcome to take a look at some of these discounts through our kp.org, Choose Healthy programs, and there's some additional discounts on fitness wear like Fitbits and Skechers and some fitness accessories also. All right, so to reach your goal and your goals with wellness support, we have the wellness coaches that we talked about. We have also some additional discounts for acupuncture, chiropractic care. We talked about the gym membership. There's also some discounts on massage therapy and more, like the activewear that we talked about. That's what's on some of those discounts available to you as a Kaiser member. So managing your care anytime, anywhere. So when you log into, when you're registered on kp.org, we encourage you to download the app on your mobile phone so that you have the information with you at all times. You can download a copy of your ID card on your phone or a picture of your ID card, Kaiser ID card on your phone, so you have it with you. You can schedule and cancel routine appointments, refill your prescriptions online. You can also see your doctor at any time online, make changes for primary care provider, your most lab test results, and then emailing your doctor, which is the most convenient service that's available. I encourage you to download the app on your mobile phone. All right, so next we're going to talk about if you're ready to make the switch. So if you're ready to join Kaiser, there's we can help you, and can help you to choose how to choose a primary care provider going on kt.org, or you can talk to someone in our physician selection line. They can help you select a primary doctor. We can help you transfer prescriptions if you are currently taking medications and you definitely do not want to have your treatment interrupted or interrupt any of your prescriptions. Help you with that. And then we can help you schedule that first appointment with your primary care doctor. So what to expect when you become a Kaiser member? So you'll get an ID card, which is your certificate getting healthcare, which is Kaiser ID card. You'll receive a welcome booklet in the mail and a welcome call from Kaiser. Once you choose a primary care doctor, you'll get a welcome letter from that physician. You'll get a pre-visit call and an email up to 7 days before your first appointment. And they can also text you on your phone. If you give them your phone number, they can also send you a text, a reminder that you have an appointment, which is pretty neat because it reminds you that your appointment is within 7 days, and then if it gets closer, they'll send you a text, another text to remind you. You can have post-visit calls, emails within 7 days from your first appointment also. So if they want to go do a post call, how did your appointment go? Did you like a physician? Do you need a switch? We can help you. And they can also help you with pharmacy and prescription transfer. So transferring any medications that you currently take. All right, so here are the plans. So there are no changes to your traditional HMO plan. This is your high option plan. This is 5 retirees. Continue to have great benefits. Your doctor visits are $10. Hospitalization is at no cost. Your outpatient surgery is $10, and all your preventive is covered at 100%. Emergency $10, and your prescriptions are 100-day supply on this plan. You have generic for 10, and generic for 10, and your brand $50. All right, so let's go to the next plan. So your next plan is your traditional HMO high option plan. This is post 65. So if you're post 65, the same great benefits, a little similar to your to the other plan, the pre-65. Again, $10 copayment office visits, hospital covered at 100%. The prescription is a little different here. It's a $10 copay for generic and $20. This goes up $10 on the brand name, 24 brand on your prescription. Also a great plan. All right, so here's the deductible HMO low option plan. This is a pre-65, the pre-65 for our retirees. So this plan is you have a $20 copayment office visit for primary care, specialty and urgent care. You have a deductible of $500 individual and $1,000 family. However, your out-of-pocket max is $3,000 individual, $1,000 family. So that's kind of a section for you, and that's the most out of your pocket in a calendar year. The lab and x-rays are 10. The outpatient surgeries are 20%. So if you take a look at this plan, the deductible only applies in your major services: your outpatient surgeries, hospitalization, your emergency care. If you stay healthy and you're just seeking care through your primary care physician, you're just paying $20 copay. The deductible only applies in your services. Prescriptions, your medications for 100-day supply, $10 for generic and $30 for brand. After the plan deductible on the brand medication. All right, so let's go to the low post 65. This is a low plan. It's a traditional plan. It does not have a deductible and co-insurance. A $25 copayment office visit. Preventive is covered 100%. Lab tests and your x-rays are at no cost to you. Outpatient surgery 5 and hospitals 500 per admission with a maximum yearly out-of-pocket of $1,500 individual. and the emergency care is $50. The prescription on this plan is $10 copay generic and $25 for brand name. Okay, so now this is a new plan. This is a plan that is health savings account. It's another option. It is a pre-65 retiree plan, and this plan has with this plan you have a deductible of $1,500 individual and $2,800 for family, or two or more, 4,000 family. This plan has an out-of-pocket match of $4,000 individual, $8,000 for family. This plan's a little different. Your preventative is covered at 100%, but there is a cost for all services before reaching. You have to reach the plan deductible first before the plan starts to cover services. After you reach the plan deductible, you have 20% co-insurance. So this plan is a little high on the upfront, the services, getting services is a little bit high up out of pocket, but it is a great plan and it does have a health savings account. Prescriptions on this plan are $10 copay generic after plan deductible and $30 copay brand name medication after the plan deductible. All right, so we talked about the plans. Now, just want to share with you some of the medical centers in Southern California. There's 15, there's 125 medical offices. There's some affiliation with some plan hospitals, there's a contract, and also with some medical clinics. Some new locations in Southern California. So one of the new locations that is opening soon is the Baldwin Park. They're getting a medical office. And some of the ones that have opened are listed here. I want to thank you for your time, and also we added 2 additional slides on the print's kind of small, but I'll have these flyers with me at some meetings. And we just wanted to provide you with a checklist. If you're retiring at 65, what you should do if you're retiring at the age of 65, enrolled at just the right time. What are some of the checklists? What do you need to know when you're retiring? This is one flyer. And this information here on phone numbers, Social Security, phone number to Social Security, some other resources, and then of course the pp.org Medicare Learning Center website. And this next checklist is if you're working past 65, what you should know, a checklist of what you should know if you're going to work past age 65. Also, this one has some additional resources, like phone number again, other Medicare.gov resources available to you. All right, well, I want to thank you for joining us, and if there's any questions, I can take questions after.
Thank you so much, Marisela. We appreciate your presentation. We are going to go over and send it to Denise for Delta. Denise, I'll go ahead and give you presentation rights.
Sounds great. And can you hear me okay?
Yes, I can hear you perfectly.
Wonderful.
Thank you.
Okay, so now we're going to switch over to reviewing the dental plans that are available through the county to help keep your teeth and gums healthy. What we'll cover today is we'll review the 2 plans, or I should say the plans that are available for January 2020. We have the Delta Care USA program, that's the DHMO. And then we also have 2 options under our PPO program. We have a low and a high option. Later in the presentation, there is a slide that gives a side-by-side comparison. So we'll review that, as well as a benefit that is on the PPO plan. It's called a Diagnostic and Preventive Maximum Waiver. We'll talk about that and explain the additional benefits that are provided to you, as well as review the cost estimator, which helps you to predict your out-of-pocket cost prior to going into the dental office. There's also wellness benefits that are available to members who are at higher risk, and we'll walk through that and how to obtain those benefits and go over any questions that you may have. And just as a reminder, for the program or for the coverage, you do need to enroll and complete and submit your enrollment form to the Employee Benefits and Service Division at the county. One of the things I wanted to just remind you, under the dental plans, there is a 24-month enrollment requirement. You're eligible to enroll as an enrollee or a dependent if you meet the eligibility requirements that are defined by the County of San Bernardino. By electing the retiree dental coverage, you agree to remain enrolled for a minimum of 24 consecutive months. It is subject to the following. So those retirees electing either the DHMO or the low PPO plan, you can switch at open enrollment between the DHMO and the low PPO plan. You don't have to stay 24 months in one of those plans. You can switch between the two. However, for retirees electing the high PPO plan, you do need to remain enrolled in that high PPO plan for a minimum of 24 consecutive months. The 24-month enrollment requirement is offset for all prior months that you are enrolled in a continuously covered program. And then retirees wishing to cancel the dental coverage at annual open enrollment are only eligible to do so after receiving that 24 months continuous coverage. So again, I just wanted to make sure that you're aware of that. There's also a new entrant waiting period, and what that is, it's for the low PPO and the high PPO plans. There's a 12-month waiting period for Class 3, which is your major restorative services, for instance, your crowns, bridges, partials, dentures, for services for retirees who've incurred a gap in coverage. So the waiting period is waived for any retiree and covered dependent that remains continuously covered when transitioning from active to retiree dental coverage. So this 12-month waiting period does not apply as long as you have had continuous coverage. Retirees who previously had COBRA benefits but did not re-enroll, resulting in a gap in coverage, they would be subject to that 12-month waiting period. So we'll start out reviewing the Delta Care Plan. As I had said earlier, it's the DHMO plan. Getting dental care is easy. You start out by choosing your primary care dentist online or by the phone. You call and you make your appointment. You visit the dentist and you only pay the copay, the designated copay. The costs under this program are predictable. They are listed in the benefit summary booklet. So all of your covered benefits are listed there, so you only pay the copay. A lot of the benefits are at no cost. There's also no deductible or annual maximum on the program. No claim forms for you to fill out, so it's easy to get your care. There's minimal limitations and exclusions. There's also out-of-area emergency allowance. If you need specialty care, that's also available with a referral. And you can choose your own network dentist. For instance, if you and your spouse are enrolled in the program, you can either elect to go to the same Delta Care dentist, or each of you can select your own dentist. For specialty care and emergency care, if you need specialty care, your primary dentist will refer you on out to the specialist. The primary care dentist requests the authorization for specialty services, and you'll take that to the specialist office. The plan also includes out-of-network coverage for emergencies, but keep in mind the coverage is minimal. It's about $100 for each emergency. So generally, I recommend that you get treated for the pain, and then when you get back in town where your regular provider is, they can help provide the rest of the coverage. how to pick your Delta Care dentist. So this slide gives you step-by-step instructions on how to find your Delta Care dentist. Again, as a reminder, you go to our website, and then there is an area where it says find a dentist, and you want to select the Delta Care network or the HMO. And under the listing, you'll see that there's a facility number for each primary care dentist. You want to make sure that you write that down, and when you submit your coverage or your enrollment, you want to list that primary care dentist so that we can assign you to that dental office. You can also, if you're already enrolled in the program, you can also change your dental offices. You don't have to stay with that dental office for the full year. If you find that there's a more convenient office for you, you can either go online and make that dental office change online, or you can call customer service at the number here. So then we'll switch over and transition to the PPO plan. Under the PPO plan, it's set up to really maximize your savings on your out-of-pocket costs when you go to a PPO Delta Dental dentist. When you visit a Delta Dental contracted dentist, there's no claim forms, and you won't be charged more than your expected share of the bill. You can see any licensed dentist under this program, but again, your greatest savings are when you go to a PPO dentist. If you have more than one coverage, we'll also coordinate that coverage for you. On this next slide, this compares your low PPO coverage to the high coverage. And I tried to show kind of a side-by-side benefit comparison here. Just at a glance, the things that stand out to me is that under the low plan, obviously your annual maximum is set at $1,000, where the high plan is at $1,700. The annual maximum is the total amount in benefits Delta will pay out in a calendar year to you and your eligible dependents. The item that I have highlighted in yellow, it's called the Diagnostic and Preventive Waived Annual Maximum. And basically, it's eligible under both programs. And what that is anytime you go in for diagnostic and preventive services, which are your exams, cleanings, and x-rays, the cost of the treatment will not count or be applied to your annual maximum. You'll be able to save that annual maximum for more expensive procedures. So again, that's an enhancement that we made a few years ago to the program. And again, I want to make sure that you're aware that those services will be covered without them having to apply to the maximum. There is a deductible under both programs, and they are both the same. It's $50 for the enrollee, and then up to a total of $150 for the family. Anytime you go in for diagnostic and preventive treatment, the other item that is nice here is that it does not, you don't have to pay the deductible towards that coverage. So it does not apply. The deductible only applies to your basic and major services. And then the lower part of this slide for the coinsurance, you can actually see the difference between the programs on the coverage level. The percentages, for instance, that are listed there, that would be the amount that Delta would pay out towards your claims. So your diagnostic and preventive under the low plan is covered at 100% when you go to a PPO dentist. If you go outside of the PPO network, it's covered at 70%. And then under the high plan, it's covered at 100%, whether you go in or out of network for diagnostic and preventive. And then the last thing that I wanted to just highlight here on this slide is implants. If you are interested in having dental implants, the low plan does not cover the actual cost of the implant, but it will cover the cost of the appliance, or whether it's a crown or a bridge that goes on top of it. The high plan will cover the cost of it'll cover treatment towards the implant, as well as the type of treatment that goes on top of it, whether it's a crown or a bridge. So you've got a little bit of a plan difference or an enhancement there when you go to the high plan. On this next slide, what I wanted to try to show or demonstrate here is some of the differences on your out-of-pocket costs, depending on what type of a dentist or network that you access. Again, you've got the freedom to go to any licensed dentist. However, you save more on your out-of-pocket costs when you elect a Delta dentist or, in particular, a Delta PPO dentist. And this example of a claim is on a crown. And what I did here is I just kind of, again, I'm listing for more demonstration purposes here. The cost of the crown is $1,200, no matter what dentist here that you've gone to. The plan allowance for the PPO plan is $700. That's the amount the dentist has agreed to accept as payment in full for that treatment. It means they're going to write off the difference between the $700 and the $1,200. When we pay the claim, we're paying it at 50%. So the plan, or Delta, in this case, would pay $350, and the patient portion is $350. And then the middle column demonstrates how the claim would pay out if you went to a Delta Dental Premier dentist. Again, this is a Delta dentist, but their fees are a little bit higher. You can see in this case, they are their plan allowance is $900. So when we pay 50%, which is the coverage for a crown on the low plan, it would pay out $450, and then the patient portion is $450. I often get asked, what's the difference between the PPO and the Premier? Well, the amount of savings is one of them, and the other thing to be aware of, Premier dentists are contracted with Delta. It's one of our, they participate in our oldest network that we've had for over 50 years. And some of those Premier providers are also PPO providers. So when that is the case, we'll pay out your claim at the PPO level. But some of the Premier dentists have only elected to stay in that Premier network. So we're going to pay your claim in the out-of-network benefits because they're not part of our PPO network, but there's still an advantage to you versus someone who's not contracted at all with Delta. And again, it's really in the savings here in the plan allowance. So they've agreed to accept the plan allowance as paid in full. So you're not going to be charged the difference between the plan allowance and what the dentist normally charges for that crown. And then the final column, again, just to demonstrate how this would pay to a dentist who's not contracted with Delta. There's a maximum plan allowance that Delta will pay on a crown, and in this example, I've placed it at $950. Now, the thing to be aware of, again, we're going to pay the claim at 50%, basing that 50% on $950. So Delta, in this case, would pay $475. But the patient portion goes up because not only would you pay the 50% of the $950, but you're also responsible for the difference between the plan allowance and what the doctor or the dentist usually charges. The dentist in this case has not agreed to accept the $950 as payment in full. So again, that adds cost to your out-of-pocket. So there is an advantage as far as to our network. You've got two levels of savings between the PPO and the Premier network. You can see here on this slide that the PPO network obviously has deeper discounts. The average discount is anywhere from 35 to 41%. And then for the Premier network, it varies from 9 to 29%. So again, if your goal is to really maximize your coverage and get the lowest out-of-pocket costs, we always suggest that you look for those PPO providers. The Premier network would be your next best option for savings. And then the slide here gives you step-by-step instructions on how to find those PPO providers online. Again, it gives you our website. and it walks you through the instructions on how to find those providers in your area. And our network is nationwide, so if you're traveling and all of a sudden you have an emergency, don't hesitate to check out our network in the area that you're in, or some of our providers there. Transition of care. If you're in the middle of dental treatment, you know, what do you do as far as if you're interested in changing plans? The one thing to be aware of is that your coverage begins on your effective date. So if you're changing from a DHMO to a PPO plan, through the rest of this year, it would be covered under the existing plan that you're covered. And then as of January 1st, the new plan would go into effect. There's no exclusions for pre-existing conditions or missing teeth. So again, you've got coverage as soon as you're effective. Treatment started before January 1st, 2020. Like I had mentioned before, will continue to be covered by your current plan. The transition of care really probably impacts the following treatment, whether it's a root canal, a crown, a fixed bridge, or partial. So depending if they've started that treatment prior to January, you want to finish that up under your current plan. Pre-treatment estimates. This is something that's not required under the PPO plan, but it's something I do recommend, especially if you're going in for extensive dental treatment, because it's a way to determine your costs ahead of time. It helps you to make informed decisions on whether or not that's the treatment for you. And everything is handled by your dentist on a pre-treatment estimate. Basically what it is prior to you actually getting the treatment, the dental office will submit to Delta Dental a pre-treatment estimate, which is the recommended treatment that they're offering to you. And Delta will process that just like we would a normal claim. We would say, okay, based on the information provided to us, here's how much Delta would pay based on the plan benefits. We would send that confirmation to you as well as to the dental office. So again, that's just, you know, a added protection that's available to you at no cost. The cost estimator, which is available on the PPO plan, is available, and what it does is it provides you an upfront cost on the treatment prior to even going into the dental office. It's available to you on the Enrollment portal for online services. It gives you an estimate based on your benefits, and it includes, you know, it takes into consideration your maximum and deductible. So it's real-time data on the type of treatment that you're going in for. It compares the cost of the same procedure at different dentists in the area. So if, again, you're going to an out-of-network dentist, it can give you what the cost would be based on a PPO dentist or based on a premier dentist. So again, it will help you see that there's areas that you could possibly save in on your out-of-pocket costs. To sign up for your online account, again, the information, you'd go to our website and the Enrollment portal is there. But again, it gives you the opportunity to view your eligibility as well as your covered services and what your level of benefits are. You can look up your claim statements for recent dental visits that you've had. You can also view or print your ID card through this, through your online access. And then, as I mentioned before, you can estimate the cost of your next procedure. And it gives you a direct communication with customer service. You can submit online questions to customer service. Anything you can do on your computer nowadays, you can also do on your mobile phone. So we do have a mobile app. And again, it provides you access to, again, the same information, whether it's finding a dentist, what your coverage detail is. You can actually view your ID card on your cell phone, as well as estimate your costs. We also encourage going paperless. For instance, your claim information or pre-treatment estimates, you can view those online. So again, just to be environmentally friendly, you know, we're definitely out there promoting that. And this slide gives you instructions on how to sign up for that online setting. The wellness benefits are geared for members who are at higher risk due to certain medical conditions. And I have a couple slides here that I wanted to review just to make sure that you're aware of this added benefit that's available to our enrollees as well as to their spouse and dependent children. It's for individuals who have one of the following chronic inflammation-related medical conditions, whether it's diabetes, heart disease, stroke, HIV, AIDS, or rheumatoid arthritis. For the PPO plan, you do need to opt in order to obtain the higher level benefits under the SmileWay Wellness benefit. You opt in through the enrollee portal, and in a couple slides after this, we'll go through how to actually opt in. But this slide in particular is for the low plan. It gives you a side-by-side comparison as to what the standard plan is versus the enhanced program under the SmileWay benefit. Again, it's geared more towards your cleaning benefits because usually with chronic diseases, your dentist will normally recommend that you have additional cleaning to help keep your teeth and gums in optimal condition. So again, under the SmileWay benefit, it provides 100% for periodontal scaling and root planing. That's per quadrant, and it's per calendar year. It also provides 100% for 4 cleanings, whether it's a general cleaning or a periodontal cleaning in a calendar year. And then on the high plan, again, the same type of information where it gives us side-by-side information. So again, it gives that 100% for 1 periodontal scaling and root planing per calendar year, and it provides up to 4 cleanings at 100%. How to opt in. Again, this is through the enrollee portal, through your online access on our website. And the online access provides you with a personal view of your benefits and your claims and your benefit documents. And then as you can see on this screen, you would click on the Benefit tab, and then under the Benefit tab, it'll say Optional Benefits. When you click on Optional Benefits, it'll show you the SmileWay Wellness Benefit screen, and you would simply just select the medical condition that applies. If you have more than one, again, you are required to sign up for one. And then there's a box underneath that certifies that this is accurate, that this information is accurate. And then you would provide the name of your physician as well as their phone number. It's not that we're going to be calling them, but again, this is a way just to document the information. And then the most critical part is there's a button at the bottom where you've got to opt in order to turn this benefit on. And once you do, then going forward, your claims will be based on that enhanced benefit. If you and your spouse both have medical conditions that qualify you for this, you would each need to sign up for this benefit. You would each need to opt in. So the previous slide was more of a visual. This gives you the step-by-step instructions on how to actually opt in. And it's my understanding this presentation will be available to you so that you can use this as a reference. Under the DHMO plan, the wellness benefit is where you, again, the same medical conditions, but you don't have to opt in. There's nothing for you to do there, but you do need to let your dentist know that you have a medical condition that qualifies you for the added benefit. And what it provides is for your regular cleaning, it provides 100% for 4 cleanings instead of 2 per calendar year at 100%. For perio maintenance, which is a periodontal cleaning, it provides you 100% for 4 cleanings instead of a $20 copayment. So it'll waive that copayment. And then scaling and root planing. Again, it's a type of a cleaning, but it's going to provide the benefit at 100% for 4 quadrants per calendar year instead of the $25 copayment. So the enhanced benefit will waive that copayment. And again, you simply let your dentist know that you have one of the medical conditions that qualify you for that enhanced benefit. And then this final slide just is a reminder that you can access your benefits and eligibility online 24 hours a day, 7 days a week. We also have a dedicated customer service phone number set up for the County of San Bernardino, and the slide provides you with that information. And if you have a dentist who's not yet a Delta Dental dentist, you can nominate them, and we'll have our provider relations department reach out to them. That information on how to do that is all available on our website. And again, this provides that information there for you. So that's really what I have to share with you today. And if you have any questions, I'm more than happy to take those, or either now or at the end of the full presentation.
Thank you so much, Denise. We appreciate your time here with us. Again, if anyone has any questions in regards to Delta Dental, you can contact Denise via the chat on the webinar, or you can contact her through her contact information that was on the presentation. So now we will move it over to George at Boya. George, I'll give you the presentation rights right now.
Great, thank you.
Absolutely.
Okay, we're going to jump right into it. Hopefully everyone can hear me today, and I appreciate all your attendance. So one thing I like to preface the Voya benefits about primarily, you've got the supplemental retirement plans, so the supplement to your county retirement and SB Sarah, and then as well we've got the Retirement Medical Trust, referred to many acronyms, RMT, HSA, or I should say HRA, correct, let me correct that, not an HSA. But so we have several different plans that we handle, but we're not really impacted by open enrollment. But I'm going to go over a few slides, which are always a great opportunity to refresh those that are in retirement, and or that way, if you haven't started utilizing your 457 or salary savings plans, or for that fact, the medical trust, you know how to do that. So I'm going to jump right into the presentation. Naturally, we're notorious for giving you disclosures and disclaimers. I'm going to go over all the various plans today, but what I can assure you is the county's got a defined contribution committee. They've hired a third-party consultant, and again, their job is to make sure that you've got the best in class as far as choices and very low fees. One thing that doesn't none of us really have the control over is the market. So you do have different investment options to choose from, some being more aggressive than the others, and obviously these things go up or down. So this, be familiar with the investment options that are available to you. Feel free to contact the local office here. I will get into a slide. There's 4 of us that can meet with you on a regular basis to review your portfolios, give you guidance. There's a lot of things that can be accomplished on the computer and or via the call center, but they're not going to give you the one-on-one service that you're going to get from us, and or maybe the advice you'll get from the local team. So again, today we're going to go over and you're going to meet your local team. I'm going to review the savings options that you have. Primarily the general employees are in the 457, but there is a 401k for the exempt benefit, as well as for most units, the county started contributing to a 401a. So based on someone's participation in the 457, the employer money goes into something called the 401a. Now, as a retiree, we've been a great accumulator, right? We're out there on a daily basis giving contributions and or presentations and or seminars, but we've accumulated all this wealth, but how do I take that money out? So we're going to cover, when are your benefits payable? What kind of options do you have? Naturally, the benefits of staying in the plan, and then I will finish it up with the Retirement Medical Trust to go over some highlights in that plan. So as I said in the intro, you've got myself, Catherine Manley, Sally Wells, and or Bob Tan. You've got Danielle Solis, who works here at the local office. A lot of people will stop by the local office, and Danielle can facilitate getting forms, assisting you with distributions, or for those that are still active, the loan option as well to you. But again, it's our job as the reps to be in the field. Occasionally, we do have office appointments scheduled here. But again, we are out in the field a lot, so you're not always going to catch a rep if you just kind of come unexpected to the office. So we always encourage you to call the office and make appointments. Naturally, a lot of things can be done by calling the customer service line at 1-800-584-6001 and or the county custom website where you can access their accounts, which is cosb.bereadytoretire.com. So again, what are your savings plans? As I said, primarily you've got the 457. That's what the general employees have participated in. Again, we're talking to retirees today, but again, not to get into all the details, the limits have gone up considerably depending on how long you've been retired. You know, an individual can defer up to $19,000 a year into the 457 plan. About 2012, the county started contributing and trying to give employees incentive to join the 457. And what they said is if you put in 1% to the 457, we're going to give you 0.5% of your base pay match. That is put into a 401A. The reason that happens is if the county put that money into the 457, it essentially impacted your ability to defer up to that maximum amount, which I said this year is $19,000. So that's really why the employer money is separate from the employee money. Then if there's any exempt employees that have joined us today, you've got the benefit of a 401K. Naturally, very similar options, and you can just defer double. And then a great way that the county has tried to help offset, you just learned about all your retiree health benefits, but one way to help defer those costs is they establish this retirement medical trust, which based on your bargaining unit, your union, there's an employer contribution that goes into here, and or a percentage of your sick leave will cash out. And then you have this bucket of money that you can use as a reimbursement arrangement. So it's not going to specifically pay your bills, but the idea is you pay your expense, then you turn in receipts, and or you would get reimbursed, and it's non-taxable, which is a great way, and that plan is growing by leaps and bounds. So again, you know, when are your benefits payable? So real important to retirees, and some of you might be getting notices in the letter. Typically they come out, if you haven't started, right about the first part of November, you're going to hear about, you know, the actual R&D. So if you've actually attained age 70 and a half, you're required to start pulling out something called the required minimum distribution. Don't be alarmed. Not all your money has to come out of the plan, but essentially the government wants you to start paying taxes on this money that's grown tax deferred all these years. So they have a formula. They want you to start drawing on it at age 70 and a half. So we don't want you to miss that, because the IRS threatens to penalize you, and 50% of what you should have taken out. So, for example, if my R&D was $1,000, you know, they could penalize me an additional $500 for not taking it. So that's why VOIA will force those out. But essentially, you know, benefits are payable to you at retirement or severance from employment. There are some slight differences between those that are in the general, the 457 plan, and the exempt group, because again, a 401K could potentially be restricted till 59 and a half. It really has to do with when did you retire. So if you retired on or after 55, then you have access to the money. If you retired and you were in an exempt group prior to 55, then you'd have to wait till 59 and a half. The county did start offering the after-tax Roth option, which is, again, primarily pre-tax dollars. Your money goes in, you reduce your taxable income, it grows tax deferred. You'll pay taxes on all this when you withdraw it, and you'll pay taxes as you receive it. So the $100,000 is still compounding tax deferred. You're only paying taxes on the $500 a month or $6,000 a year. However, the Roth, if you made a decision to put away that money on an after-tax basis, it's going to grow tax deferred, but the interest will come out tax-free. That money you can't touch until 59 and a half, okay? And they are all subject to 70 and a half as far as minimum distribution. And naturally, keep your beneficiaries up to date, because God forbid if something were to happen to you, we want it to go to one of your loved ones of your choice, but it's naturally going to be paid out to your beneficiary, and they are taxed based on the dollar amount that they take out in the year that they receive that money. So I kind of got into some highlights on the required minimum distribution. It must start, kind of a mouthful, by April 1st of the year following that you're 70.5. So again, if someone were turning 70.5 today, you actually don't have to start that distribution until April 1st of next year. However, what ends up happening is you end up having to take out your 2019 RMD by April 1st, and you still have one due for 2020, so you end up taking 2 distributions. So when you consult with the VOIA reps, we would always encourage you to get it started here by December 31st, and again, take it out in December. So the VOIA procedures, they've changed, recently. So what you would normally do is you would contact the local office here. We can generate forms, but what I mean, they just changed, and I didn't have the opportunity to create a slide because it just went into effect last week. This is real critical. I would really encourage everyone to access your account electronically online, via the web, and or VOIA sent out a 6-digit PIN over the last year that you needed to update, because individuals can now do a phone distribution, a paperless distribution. On the other hand, if you're old-fashioned, you want a form, you want to sign it, you're going to want to call the local office, and you still have the ability to generate paperwork. But as far as the required minimum distribution, as I said, this letter is going to come out here in November. They would typically say, we're going to send you this RMD based on before April 1st, and then every December thereafter, they're going to make sure that you're taking out your minimum amount. On the other hand, if you want to specify when you want to receive that required minimum distribution, you can say, you know what, it'd be great. Every year I take the family on a trip in June. I want my required minimum distribution in June. You want to set up a reoccurring distribution. That way you can specify what month you're going to get that money. Set it up, include your banking information so they can send it electronically to your bank. Now, most people do what's called a systematic withdrawal, and that's where you meet with SB Sarah, you're starting to collect your county retirement, and a few years goes by and you're like, well, inflation, things are catching up, I've got this money in there, I'd like to start pulling out an extra $500 a month. And so that's what's called a SWO, a systematic withdrawal, and you can do that at any time, but you're also free to take out distributions, partial distributions at any time. And I'll go into a few more of those details shortly. So what happens if you were to leave service? You don't have to take your money out. So that's a pretty common phone call that we get from retirees, like, I'm leaving the county, and what should I do with my money? Do I have to roll it to an IRA? No, you can leave it in the county's plan. As we said, you're not required to pull money out until age 70.5. And in between the time that you left, if you left at 60 and, a year or two goes by, you could call up and say, hey, we're taking a trip and I'd like X amount of dollars in a partial lump sum. That will be taxable to you in the year that you receive it. As I also covered in the previous slide, the systematic withdrawal, you'd just like a little extra money coming in on the 15th of the month, and you specify a dollar amount or a time frame. The next bullet point called our state conservation option. This is something that you would do if you are 70.5 and you wanted to know when you're going to get that required minimum distribution in a specific month. Now, we've done several seminars throughout the years in coordination with the retirement system, and one of the biggest things I would think that they would always state is like, hey, the difference between your pension and like a VOIA, your supplemental retirement, is that we're going to give you your pension forever from SB Sarah. Well, we can do that too in your deferred comp. It's just in the form of an annuity. And so an annuity is something that you actually, set down, it's in concrete, you decide to take a distribution over you and your spouse's lifetime, and you don't have to worry about the market. Essentially, you're going to get guaranteed income forever, regardless of the value runs out or not. Now, you can roll money into the plan. That wasn't always the case. It's been around for the last 15 or so years. Before, it was like you could only move a 457 into a 457. Well, now, naturally, all these plans are interchangeable. So you can roll a 401k from a prior private sector plan into your 457 or vice versa. The only thing I would talk about as a retiree, again, if you're under the age of 59 and you take your 457, which you can take out at separation, and you roll it to an IRA, you're now going to lock your money up until 59.5. So that's where you're going to want to always consult with the local office, because we specialize in 457. And naturally, doing a lump sum, a systematic withdrawal, or annuitizing your values, you can do a combination of all these options. But that's where, again, with the ability to start doing distributions via the telephone paperless, again, you're going to want to consult with the local office so we can run some illustrations for you and explain how all these work in conjunction with your retirement. So I'd encourage you to, again, first meet with, again, SB Sarah, and then obviously meet with the Voya reps. Now, benefits, how are they taxed? They're taxed as ordinary income. You're going to get a 1099, so those that have been retired for a while, you get a 1099 from SB Sarah, you get a 1099 from Voya based on the dollar amount you take out. Now, standard taxes in a lump sum or a partial lump sum is 20% withholding for federal. If you're still living in the beautiful state of California, they're going to withhold 10% of the 20, which is 2% for state taxes. It's all based on the state that you live in, so light bulb might go off. A lot of people say, what if I moved to Nevada, there's no state taxes? Well, then we're not required to withhold California taxes for you. Again, so just an example, if I were to say, George, I'm taking a trip and I want $10,000 out, and you did standard taxes living in California, you're going to end up netting $7,800, right? Because you're going to withhold 20% for federal, 2% for state, and at the end of the year in January, actually, at the beginning of the new year, you'll get your 1099. You'll take that from Voya, the 1099 from SB Sarah, and do your taxes just like you would when you were in your working years getting your W-2s from the county. The only caveat here, difference, is the third bullet point, which is the 457 Roth or the 457 Roth 401k. Again, that money has to be there 5 years from the time that you actually first contributed, and you have to be 59 and a half. So that's where it changes the 457 rules a little bit. But in order to pull that money out free of taxes, so you'd still get a 1099, but would this be reported as non-taxable distributions because you met those requirements? So again, you can always generate 1099s. It's a pretty common phone call that we'll get the first of the year. Is when was my 1099 going to be mailed to me? You can generate that off the internet, so another advantage of being able to log into your account. As I talked about the paperless distributions via the call center, they're going to verify your PIN, verify your identity, get some disclosure on the recorded line, but as well, you can generate distributions right via the website now. So there are some real benefits of having the functionality of being able to log in. If you need help, call the local office and we'll get you set up. So, you know, there are many benefits of staying in the county's plan when you leave. You've got a diversified investment options to choose from. You've got the due diligence and the fiduciary responsibility of your committee to make sure that the funds that you have available to you are performing. Again, continued exemption from the IRS 10% premature distribution penalty. That was what I was talking about. If you were to roll your money, if I retired the county at 50, rolled my money to an IRA, well, now I locked myself up until 59 and a half. And if I needed that money, I'd be subject to an additional 10% penalty on top of income taxes. So that's the benefit of staying in your 457 plan. Lower fees. This plan, fees are not going any higher. They're only going lower as the plan grows. You're getting the savings passed along to you. You've also got the benefit of the stable value account that's earning 2.65% currently through the end of the quarter. Keep in mind, think about your past books at a bank. What are you getting on the savings account? Very, very low interest rate. So that's the benefit of staying in the county's plan. The no annual administrative expenses for the deferred comp and continued access to the local team. So really a lot of benefits of keeping your money in the county's plan. Now, jumping ahead to the Retirement Medical Trust, again, this was established. It was initially an exempt benefit. I think Voya took it over, and that was formerly ING in 2005, and it's really grown. I think it was only like a $5 million plan. There's well in excess of $80 million because, again, this is one way that the county's realized that it's going to help you offset the one thing we're facing, and that's the huge cost of medical insurance and or medical care going into retirement. So, again, based on your bargaining unit, a contribution was put in by the county, and then a percentage of your sick leave based on someone's MOU was dumped in. So some of you that have been retired for a number of years that were not exempt probably don't have money in this plan, but any recent retirees would have had their sick leave dumped into this plan. So, again, the contribution from the county went in before taxes. It grows tax deferred, and then what we use to dump in that percentage of sick leave. And again, I have not kept up with all the changes, but the general employees, it was typically about 60% of 1,000 hours, and I think those numbers have changed dramatically. Again, you want to contact TASK. So we use a company called TASC. They're the ones that are the claims adjudicator. So you could call the 800 number for the retirement plans, say, I've got this money in the $50,000 in the retirement medical trust, and the VOIA reps on the other line are going to say, what? We don't see this account. So that's why it is a completely different website, hoping that there would be like a warm handoff from the call center, and or when you log into your account, you'd be able to click to get to the TASC site. That doesn't exist yet. But again, there is a different website. I previously opened by giving you the cosb.bereadytoretire for your retirement plans. There is a link to the medical trust if you were to go to that website, but the medical trust website is www.voia.com/HRA, which stands for Health Reserve Account. As far as things that you want to consider, actually I want to go back to this slide. I mentioned earlier that the fees don't change in your deferred comp, and they do actually change a little bit in regard to the retirement medical trust, because when your claim's active, which means you're retired now, and if you were a general employee, you're 55 or over, you're now eligible to start filing claims on that. That's kind of where TASC covers some of their fees, and there's a monthly fee that comes out of your statement. You'll see that come out, and so that's the only place there's an increase. It is, again, an account that, unlike your deferred comp, where you're going to pick your beneficiary, which could be your brother, your sister, your niece, your nephew, the medical trust is for you, your spouse, assuming you're retired and you don't have a special needs situation, your children out of the house. This money goes back to the trust, so you want to use that, even though it's kind of like, I'm trying to manage expenses. You know, my parents lived, and then my mom started getting, say, some type of Alzheimer's, so I'm saving this money for a day when I'm going to need some additional funds or care. But on the other hand, if something were to happen and you were to pass, it goes back to the trust. So there's really a balancing act. And I would say most people retire from the county, they got COBRA, and they say, I can manage that. And then maybe there's a gap between when COBRA runs out after the 18 months federal, and then you got 18 months Cal COBRA if you're still in California, right? And then you maybe got a 2 or 3 year period before you get to Medicare. That's a great opportunity to utilize some of these dollars. The one thing I'll mention, because I meet with retirees on a regular basis, perfect time, open enrollment, right? You're learning about new rates. So there's 2 different ways that individuals can file claims. Again, all this can be done electronically and uploaded right to the TASC website by going to the website listed here below, and these slides will be available. But you either keep all your receipts, turn in a form, fax it in, upload it, and you get a check sent to you for everything that's reimbursable. Again, that just depends on your cash flow. On the other hand, there's something called a reoccurring expense, which would be like you retire, you're starting to pay your insurance premiums out of your SB SARA, you want to be reimbursed for that $700 that's coming out to pay for your health insurance provider, and you turn in that reoccurring form. Well, what happens? Each and every year, you've got an open enrollment. You find out about new rates. Did costs go up? Did they go down? So you need to re-up and turn in that reoccurring expense form on an annual basis. So if you're not keeping track of it, you could end up saying, wait, what happened? I'm not getting that $700 reimbursed to me electronically anymore because, again, your 12-month period ended. So for the reoccurring expense on the retirement medical trust, you need to turn that form in and do that on an annual basis. So I would encourage you, even if you're retired, you're sitting on money, you're approaching 70 and a half, to contact the local office. Our office is in Redlands on Nevada Street, 1030 Nevada Street. We're upstairs, suite 203. And again, the local office number is 909-748-6468. Again, if you haven't logged into your account, you're going to need to call customer service to have them generate a 6-digit PIN. If they've got your current email and or a cell phone, they can text that to you, and that makes it very simple to then log in and reset that PIN. If they don't have current information, they're just going to have to mail it to you, which is going to delay the process if you're going to want to do a distribution via the paperless distribution system. And then keep in mind there are 2 different websites that you have access to for the retirement plans and or the medical trust. So again, hopefully you find this information very helpful, and look for us out at additional retiree open enrollment meetings, and as well, there are a handful of seminars we'll do throughout the year that are still available to retirees as well. So I really appreciate your time here today, and look forward to working with you in the future. Thank you.
Thank you so much, George, for presenting the VOIA presentation. So that concludes our Retiree Open Enrollment 2020 presentation. We will go ahead and post this webinar online for everyone to be able to view. Should be posted by the end of this week. If anyone has any further questions, please go ahead and send them through in the chat, or you can also contact us at ebsc@hr.sbcounty.gov. Thank you so much. Everyone have a great day.